What are the signs and symptoms of a heart attack? The pain of a heart attack can be experienced and described in many ways, such as chest discomfort might the chest discomfort might pain, fullness, feel of tightness, and squeezing. They all should be considered the same as potentially coming from the heart. We also have jaw ache or pain, which feel like a toothache. We have shortness of breath, nausea, vomiting, upper abdominal discomfort, heartburn and indigestion, sweating, discomfort radiating to the shoulder and down to the arm. Either arm can be affected, but more often it is the left arm. We have upper back pain, general malaise or vague feeling of illness. Symptoms that don't appear serious or severe and are ignored. Those are some of the signs. And even though the symptoms of a heart attack at times can be vague and mild, it is important to remember that heart attack producing no symptom or only mild symptoms can be just as serious and life-threatening as heart attack that cause severe chest pain. And too often patients attribute heart attack symptoms to indigestion, fatigue, or even stress, and consequently delay seeking prompt medical attention. Sometimes chest pain should not be ignored. In people who do not have the diagnosis of coronary artery disease or angina, which is angina is a chest pain, it may be very difficult to decide whether the chest it might be very difficult to decide whether the chest tightness, shortness of breath, and nausea is due to a heart condition or some other causes. You need to seek medical attention immediately for help. It is very important to seek prompt medical attention in the presence of new symptoms such that may suggest a heart attack. Early diagnosis and treatment saves lives, and delay in reaching medical assistance can be fatal. A delay in treatment may lead to a permanent weakened heart due to heart muscle damage. Sudden cardiac death is always a concern for healthcare provider. Monitoring for heart rhythm abnormalities like ventricular fibrillation is one of the first steps in caring for a patient with chest pain. That monitoring begins with paramedics on scene and continue throughout the care provided. Heart attack symptoms in women. Heart attack is the number one cause of death in women in the US. Yet, women are more likely to encounter delay in establishing the diagnosis of heart attack than men. Part of that delay is the fact that women tend to minimize their symptoms or ascribe them to less life-threatening conditions like acid reflux and flu. While heart attack symptoms in women are the same as those in men, women may also present with angina symptoms that are more subtle and may include the following in isolation or in combination: one, neck and shoulder pain, upper abdominal discomfort, nausea and vomiting, fatigue, and shortness of breath. Silent heart attack. Heart attack with few or no symptoms causes almost half of all heart attack and occur in both men and women. There are many causes of chest pain that are not heart related, and often people attribute their symptoms to a cause like heartburn, gastroesophageal reflux, or GERD, or chest wall muscle soreness. While women will present with similar symptoms as men when having an acute myocardial infarction, depending upon the type of heart attack, they are less likely to receive the same aggressive care, including heart catheterization, angioplasty, and stenting. When heart attack diagnosis is made by changes seen on the EKG, men and women receive the same care. Women tend to not be aggressively treated with medication compared to men to limit the extent of a heart attack. These medications, which include aspirin, beta blockers, and statins. After having a heart attack, women are less likely to be referred for cardiac rehabilitation and physical therapy. And what are the complications of a heart attack? We have a sudden death. When a person dies in the first minute or hour after having an attack, it is mostly likely due to ventricular fibrillation, a heart rhythm disturbance. The heart is a two-stage electric pump. Normally, an electric signal is generated by specialized cell in the upper chamber of the heart and then spread along the electrical pathway to the ventricle to allow all the heart muscle cells to contract and pump blood to the body. When a heart attack occurs, heart muscle cells that lose their blood supply can become irritable and beat chaotically instead of together with one other muscle cells. Instead of generating a heartbeat, the ventricle fibrillate and no oxygen is delivered to the body. This is sudden death. The treatment for sudden death is the same regardless of whether the patient collapses at home or in hospital. Outside the hospital, bystanders, CPR, calling the emergency call numbers like 911, and the use of automatic external defibrillations increase the chances of survival. Heart muscle that lose its blood supply and is damaged because of a heart attack is replaced by scar tissues. Depending upon how much muscle is damaged, the heart may no longer be able to beat as strongly and efficiently as before. The heart may not be able to pump blood to all corners of the body and supply the oxygen that it is needed for a normal function, and that will make a compromised heart functioning. Remember, symptoms of heart failure include fatigue, shortness of breath, cough, and swelling in the feet and ankles. Thank you for watching this video. Consider subscribing, like this video, and hit that notification bell so that you may be notified when we upload a video.